Hi, I am Dr Yashavanth, consultant gastroenterologist from Bangalore Institute of Digestive Sciences. Today I will be talking about a bacteria, Helicobacter pylori. Helicobacter pylori is a gram-negative spiral and flagellated bacteria. Flagella means it's having tentacles which helps in the movement of bacteria. Why we should know about this bacteria? It's a bacteria with a magnitude of which affects nearly 50% of the population. Magnitude is so high that it affects nearly 50% of the population, and it's more common in developing and underdeveloped countries. In India, it affects nearly 60 to 80% of the population. Luckily for us, not many will have symptoms. Only a fraction or up to 8 to 10% of the affected population will have symptoms. Which area it affects? It affects stomach and duodenum. Duodenum is the initial part of small intestine. What does it cause? It can cause gastritis, it can cause ulcers in stomach and intestine, that is in duodenum. It can cause carcinoma, it can cause gastric lymphoma. So that's why it is important, but it causes in a very small fraction of the affected population. So what are the symptoms? Majority might not have any symptoms. Some will have symptoms. Nearly what I said, around 8 to 10% might have symptoms. Symptoms might be bloating, and postprandial, after eating they might have bloating, upper abdominal pain, burning sensation, they might have vomiting or nausea sensations. So very rarely they can even have iron deficiency anemia and weight loss. So how are we going to diagnose this Helicobacter pylori? So to diagnose, we have 4 tests. First is serological test, that's in the blood test, but it's not so useful because who are infected in the past, who are being treated, also will remain positive. Second is breath test. Third is stool test, which also can detect whether the H. pylori or Helicobacter pylori is there or not. Endoscopy, in addition to whether there is a Helicobacter pylori is there or not, it also gives additional information whether there is any damage to mucosa or ulcer, or there is any obstruction, or even early cancer is there or not. It gives us an impression on that. Based on that, we'll be able to take further measures which are required. So how are we going to treat? See, the treatment requires 2 things. One is the antibiotic, the other one is PPI or proton pump inhibitors, which will suppress the acid production. Treatment is never an emergency. In case if you are undergoing any other therapy, or if you are planning to travel, so it can be postponed. Once you start, 14 days of therapy should be followed. The antibiotic dose which is required for treating this bacteria is quite high compared to other usual bacteria. So the antibiotic associated adverse events or adverse symptoms might be there, like bloating or increased frequency of stools, little bit of sounds in the tummy can happen when you are taking the antibiotic, but that should not stop you from taking the antibiotics. Once you complete 14 days of therapy, which is decided based on which region you are from, based on the antibiotic resistance. So most of the time you will be able to achieve the eradication of this bacteria. Once we achieve this, most of the symptoms which are due to this bacteria will disappear and you can lead a regular life. Most important thing, how are we going to prevent? See, most of the bacteria is transmitted through oral route, taking unhygienic water through any means. So simple measures like hand washing, having a boiled water, or having a clean and pure water will help in preventing the reinfection of the bacteria. And also in the children, make sure they don't eat from unhygienic places to prevent the occurrence of this infection. That's all. So by doing a simple hand wash and following hygienic steps, we'll be able to prevent this infection. Thank you.